Christian, what about you? Number of patients you're seeing, clients you're seeing that are worried about the virus. Often, some of the symptoms I think of COVID and the physical manifestations of worry and stress might mirror each other. We'll get to that in a second. But are you seeing more patients that are coming and saying, "I'm scared to death of this thing"?
Absolutely. I think the majority of the increases of mental health conditions are really twofold, because you see the adult population and the youth population, and within the adult population you see an increase in depression, and really increasing of isolating self from family and friends, and detaching individuals from their family, and also having a negative self-talk. So what you're seeing people kind of back into the mental health portion of being affected. So they notice that they're having more negative self-talk, more hopelessness, being more moody. Now the individuals are working from home now. They're maybe staying in bed a little longer, waking up a little later to go to work, and then now that goes, oh, I'll wake up at 9 a.m. Oh, I'll wake up at 10. Before you know it, they're sleeping for the whole first half of the day. So people are really backing into being aware of these symptoms. From especially depression in men can sometimes look a little different in women. The tearfulness and excessive crying, loss of desire, things of that sort. But also the anxiety and generalized anxiety disorders also really been prevalent in terms of the diagnosis within youth and adults. And really within youth, it's interesting because the substance abuse has really been very prevalent amongst the youth population, whether that's alcohol use or cannabis use. So that's also another thing that's really coming forth. And also, you see youth witnessing more domestic violence cases. So now individuals are home more often. So so now the children are being able to witness what's going on, the family structure of what's going on within mom and dad. Also an increase in child abuse cases. Majority, over 50% of youth access mental health services through their educational institution, through schools, through after school programs, through the teacher noticing that there's a concern. So there's no school right now. So how are these children accessing services? So that's also been a really challenge. And also in terms of reporting a lot of mandated child abuse reports, those come through educational professionals. So if that component's not there, who's reporting these cases that are ongoing within the home?
Excellent points, Christian. And I hadn't even barely begun, because my own children are adults now and out of the house. I can't imagine, hadn't even thought about right away that added level of stress for the kids in the home. Let's talk about a little bit, we touched on it a second ago, but let's talk about the impacts of worry and stress on the body. I alluded to it before. I think maybe some of those symptoms can mirror each other. And I'm wondering if that makes it harder, if I'm right about that, if that mirroring makes it harder to diagnose and treat patients who are infected by the virus. Maybe Sheree, you could start us off there. Do the symptoms appear similar? And if so, does that make it harder to get at the problem?
So if you think of symptoms kind of like fatigue, headache, some of the generalized symptoms of COVID-19, yes, those are some of the same symptoms you could have from your stress being exacerbated, or just other types of ailments. I feel like the CDC guidelines and all of the institutional guidelines in our community, in the healthcare community, have really led us to be able to identify and test and appropriately treat patients with COVID-19. So I think there's a pathway to getting proper diagnosis and treatment, but I think the personal component, could you sit at home and psych yourself out, or could you feel you're having symptoms, or what we'll say in the medical community, like psychosomatic, that you are perceiving that you're having symptoms that you may not be physically having or that cannot be assessed by a medical professional. So those things can particularly happen. And it results in people getting tests multiple times because of worry and stress and feeling that they do have the virus and they may not have had the virus or even been out of their home. And that utilizes resources. So that definitely can happen. But I feel like in the medical community that especially from the beginning of the pandemic till now, we have more information and we have a handle on properly identifying those that do have COVID-19 and then moving forward with the proper instruction from there. And we're guided by it, and it's dynamic. Things continue to grow and change as we get more information, as more research is done. But could it confuse the patient that is at home thinking about their own symptoms and when they should call in and or seek help? Absolutely. So I think they have to use their resources through their health institution that they're connected with. And when in doubt, please call. We'd rather figure it out than you have COVID-19 and then also be around others and not socially distancing and doing all those preventative measures from spreading it. So while it's okay to find out, it's also really important to find out those types of symptoms you should be looking for and when to seek care from a health professional.
Excellent, excellent.